What needs to be measured? As treating physicians, we need certain measurements to monitor the progress of the spinal curve. Clinical measurements allow early assessment of whether a case of scoliosis that has only been observed so far has deteriorated to the point where treatment is required. If the scoliosis requires treatment, the clinician must be able to determine if physical therapy alone is sufficient or if a brace is indicated. We also use clinical and radiological measurement techniques that allow comparisons to be made at later visits. So, what should be measured? Let's talk about radiography first. To verify scoliosis, the doctor needs an X-ray. If possible, a standing full spine X-ray should be taken to monitor the progression of the condition and should be taken from either the front or back. Initially, lateral X-rays may also be needed to rule out visible malformations. The frontal radiograph can be used to measure the angle of curvature and to determine if there are any rib or vertebral abnormalities. It can be used to confirm the diagnosis of idiopathic scoliosis or, in the presence of vertebral or rib malformations, to confirm the diagnosis of congenital scoliosis. The lateral radiograph allows detection of any deformity in the lateral view, to detect a hollow back in the thoracic spine and/or lumbar kyphosis. X-rays of this type and size naturally involve some radiation exposure. However, this cannot be avoided. X-rays are essential whenever there is an expectation of deterioration following clinical measurements, or even to monitor brace treatment. In my office, I did not even regularly order a lateral view after the initial radiographic evaluation, because the lateral profile of the spine can be adequately determined by clinical methods. In addition, a so-called low-dose X-ray allows the radiation dose to be reduced by shortening the exposure time whenever possible, provided that only the angle of curvature is to be measured. We use the X-ray to measure the angle of curvature, usually according to COP. This angle of curvature is also checked on follow-up radiographs. The treatment indication can then be derived from the magnitude of this angle according to current treatment guidelines. Here is an image of the entire spine of a patient with idiopathic scoliosis. As you can see, the head and parts of the legs are on the X-ray, which is not necessary. In the side view, the middle image, no gonadal shield is applied. On the right image you can see the region of interest, which allows you to diagnose the patient well and also measure the COP angle and see most of the spine. Radiation exposure can be drastically reduced by limiting the field to the region of interest. On this slide, on the very right, is a schematic representation of the angle of curvature formation. The plate covering the upper neutral vertebra, which is usually the most tilted, is marked with a tangent line, as is the end plate of the lower neutral vertebra. Vertical lines are aligned with these tangents and form the Cobb angle of curvature, shown here with the angle symbol. Some years ago, a new stereoradiographic system has been introduced. The EOS imaging system is a low-dose, full-body system that allows three-dimensional reconstruction of the spine and automated objective measurement of all angles of curvature. There is access to the images and a comprehensive report that is automatically recorded. The current disadvantage of the system is the high acquisition cost. According to recent findings, the risk of blood and breast cancer is not drastically reduced. Let us now focus on the clinical measurements. Clinical measurements include standing and sitting height, body weight and lung volume, vital capacity, quite different measurements that are not always routinely performed in every practice. For practical use, it is important to have clinical measurements that allow direct comparison of curvature or deformity values. The simplest measurement in this context is the measurement of trunk asymmetry with the Bunnell scoliometer. This was developed in the United States primarily to provide a simple and inexpensive method for screening examinations in schools. However, this device should also be available in orthopedic practices and scoliosis clinics, as it can be used to detect signs of possible deterioration in curvature during follow-up examinations. The scoliometer measurement, the angle of trunk rotation, ATR, is usually performed during forward flexion with the knees in extension. Today, these measurements can also be performed with a smartphone. If this scoliometer measurement is performed by the same doctor at each visit, it is very accurate and a small average error of only about 1 to 1.5 degrees can be expected. Since scoliosis is first noticed by a change in the shape of the back, it is conceivable that this changed shape of the back could be photographed and then perhaps evaluated with a computer. The use of surface topography systems is becoming more widespread. Such topography systems make it possible not only to store the shape of the back on a computer and print computer image, but also to automatically determine a variety of measurement data and make them available for later comparison. In the past, children with scoliosis were x-rayed about 4 times a year, sometimes even more, resulting in high radiation exposure. The availability of surface topography makes it possible to eliminate x-rays as long as there is no evidence of deterioration. Thus, radiation exposure can be reduced, hopefully reducing the increased risk to scoliosis patients. Various measurement techniques are available for monitoring the progression of spinal curvature. The Quantec and ISIS systems, which are manufactured in England, were developed specifically for monitoring the progression of scoliosis. Since these measuring devices can only calculate the scoliosis if markers are glued to the skin, they have a lower measuring accuracy than fully automated devices such as the Formetric system developed in Germany. The Formetric system automatically detects the topography of the spine and calculates the angle of curvature from the measured coordinates. It also automatically provides a wide range of measurement data. It can detect not only the scoliotic deformity of the spine, but also hunchback and hollow back or flat back conditions. The Formetric system is therefore accurate enough to replace X-rays, at least in part. However, if the results indicate that the situation has worsened, an X-ray is essential, as well as for monitoring the treatment with a brace. The latest development is the use of full-body 3D scanners to measure the size of the trunk in preparation for computer-assisted brace application. When these scanners are used, clinical progress monitoring can be performed at the same time as the patient's measurements are digitally taken for brace application. In the future, such multifunctional use may well enable specialist practices to offer surface topography for monitoring patients' spinal deformities to members of the National Health Services at more affordable prices. More information can be found in the Scoliosis Guide for patients and families, shown here on the left, and in the Schroth Best Practice Academy textbook, shown on the right. You can download both books for free. Please use the QR code below.